I'm Dr. Melanie Palm from Art of Skin MD in San Diego, California, and today we are talking about infrabrow filling, which is filling this upper part of the eyelid. We actually lose volume there. There's some distinct fat pads that tend to lose volume over time. So some people start to get really deep set eyes, or they notice a notch in this, what we call middle or medial part of the upper eyelid skin, which is called an A-frame deformity. So we can actually use filler or fat to be able to add really pretty, subtle, natural, very rejuvenating sort of effects to that area, and recontouring the eyelid to what it looked like without performing something like a surgery, like an eyelid surgery or a blepharoplasty. So it's important to have the right sort of patient. I'm actually going to show this here. She's done a little topical numbing and we've cleansed the skin. And I make a little added point or an entry point. This is a 25 gauge needle, and then there's numbing pre-incorporated. I use a couple of different fillers. This happens to be Restylane. Occasionally I use Restylane Refine, but you want a particular kind of hyaluronic acid filler that's got good qualities for this upper part of the eyelid. And then with the cannula, I'm just feeding through the subcutaneous tissue. And this patient's had this procedure before. We're just doing a small touch-up. It usually doesn't require a lot. You can see my little cannula tip is advanced all the way here. And this is really where most people lose some volume. So we're just putting some little drops with the cannula to restore that volume again. Patients can get a little bit of swelling. There's very low risk of actually bruising with this because we're using a blunt-shaped cannula. At the entry point, it could be possible, although in my experience, that's been pretty rare. They can get a little bit of swelling afterwards, so I tell patients, you know, for several days afterwards, you want to make sure that you're aware of that. You know, they're not doing something super special like taking family photos or have a special event that they're going to. But on average, I use a very small amount. It's usually 0.1 to 0.3. You can see I'm just smoothing that area, and that's very rejuvenating in this area to give a little bit of volume back. But that's essentially infrabrow filling using a cannula. If you have questions about it, you can visit our website, artofskinmd.com, or call us at 858-792-7546.